Minister, I appreciate you coming in here this morning to take the questions. I'd like to raise with you the issue of paediatric patients in CUH in Cork and the issue around type 1 diabetes and the lack of provision of insulin pumps in particular causing a concern for parents. Many parents that I've spoken to, and they've been calling for additional staffing and resources for a number of years now. It's been an issue there for quite a while. And I believe that many of the issues again surround employment and the inability to appoint consultant and nurses in that space, and it's proving quite difficult over the last number of years. Many children and their parents that I've spoken to have received initial appointments, and they would be praising the CUH staff and the service that they've gotten, the level of service that they've gotten till now. But unfortunately, after the initial meet and consultation, there's an issue in relation to insulin pumps in particular. Many parents that I've spoken to have been waiting over a year, waiting for those new pumps to be approved, for people to be trained in the use of them, both in CUH and training the parents and the families themselves. Obviously, the great benefit of the pump therapy is that it reduces people's reliance on having to give themselves injections possibly repeatedly throughout the day. So it is a much better process than the older, outdated process. I'm aware of one boy in particular who's 4 years of age, who's due to start school in the coming September. And his school and his SNA in particular have been great, and they were all ready to be trained up to help him with his injections, or to do the injections for him while at school. But unfortunately, at the last minute, CUH have now withdrawn the potential for training those school staff members in relation to making sure that that young child can self-medicate. That's a specific circumstance, obviously, but I think it's indicative of the wider problem surrounding staffing and training. I understand also that there's a severe shortage of consultants in the field, and I do understand that I think CUH currently has 1 whole-time equivalent and 2 diabetes nurses, and I understand that there's a further 2 to be hired, I believe, but we're still waiting for them, I think, to actually start. And much of the correspondence that I would have surrounds, commencement will happen shortly. But for many of these families, as I said, they're waiting 2-3 years, and shortly just can't come quick enough. I understand as well that the consultant that's in place in CUH currently has between 400 and 500 patients under his care. And even that same consultant has issued guidance notes previously that, in theory, any consultant should only have 150 patients, paediatric patients under his care. So services are severely under pressure there. A number of children on the pump therapy also are awaiting new pumps. Many of the older pumps have expired, or the warranty has expired on them, and again there's delays in issuing new pumps and getting people the relevant training on the new pumps so that they can carry over. So again, they've had to revert to the injection model, which again isn't ideal. Look, it seems to be, the problems around vacancies and employment in the HSE seem to be catching up with us again in this field from looking from the outside in. And I'm just wondering if you have any update on the matter in terms of the commencement of those much needed staff. I want
to thank the Deputy for raising this issue and for giving me the opportunity to provide an update to the House in relation to the paediatric diabetes clinic services in Cork University Hospital. And I do take on board the situation you raised about a young 4-year-old with type 1 diabetes and starting school for the very first time, and then trying to cope with all the intricacies of that. As you are aware, that type 1 diabetes is an intensive condition to manage. Commencing a child on an insulin pump requires intensive education for not only the child but the entire family, and obviously the school as well and the SNA that would be involved. It involves close monitoring of glucose levels and insulin doses, particularly in the early stages of insulin pump use. To support the child and the family, an intensive programme is put in place by the multidisciplinary team. This helps to optimise the child's health and prevent hospitalisation. Specialist nurse teams work closely with the family to allow for close monitoring, insulin pump dose adjustment, and ensuring that the child and family have guidance and support during intercurrent illness and outpatient appointments. The HSE has advised that in relation to services in the Cork area, Cork University Hospital is a centre for paediatric diabetes, providing care for patients in the South West region. There are currently over 525 paediatric patients attending the diabetes service in CUH. In CUH, the multidisciplinary team have met and reviewed all patients who will be prioritised in line with the individual patient's clinical need based on best practice and international guidelines in the recommencement of the insulin pump service. The HSE has advised me that the new pumps are due to be available in CUH by the start of July. A small selection of children will be started on the new pumps, and it is planned to increase the number as more supplies become available in CUH. Children will be supported and guided in their use on a case-by-case basis. The HSE have assured me that engagement is ongoing with the Cork Diabetes Parents Group, the T1 Diabetes Alliance, who are being kept updated on service developments. The HSE has also confirmed that the CUH paediatric diabetic team is comprised of one, as you said, whole-time equivalent consultant dedicated to the paediatric diabetes and endocrinology service. This is provided by 2 paediatric consultants with a special interest in diabetes and endocrinology at half a whole-time equivalent each. There is also a full-time dietitian in post and 2 whole-time equivalent diabetes nurse specialists in post. The HSE has further advised that additional staffing resources were secured by way of a business case submitted by CUH to the South West Hospital Group, where an advanced nurse practitioner and 2 additional diabetes nurse specialist CNSs were secured for the paediatric diabetes service. These posts are being progressed through recruitment, with a CNS panel being available to allow for the direct progression of the CNS positions. But I do take on board what you've said. It can't happen soon enough, especially with 525 young children attending the service. The Government, along with the Department of Health and the South West Hospital Group, are fully committed to the progressive development of the paediatric diabetes clinic service within the group and to improving this service for patients of the South West region. Thank you.
Yep, thanks, Minister, and I appreciate the response. And it's similar to some of the responses that I would have gotten over the last number of weeks. Look, I suppose I'm in a fortunate position. I have 3 children, and so far I'm unaware of any, medical needs that they may have. They're very young, and hopefully they will be, fine when it comes to issues like type 1 diabetes. As you said, it's a severe illness and will affect people for the rest of their lives. But for me, when you engage with the HSE, when you engage with, health services in the country, these letters kind of are the things that infuriate people. When we talk in language about shortly, no definitive timelines, even indicative timelines, and communication is ordinarily quite scant, and that's the thing that frustrates parents, and it's the thing that I suppose causes most concern. And I do acknowledge, as you said, that recently CUH have engaged with that new parents group, and that is welcomed also, and I know that a number of the parents that I've spoken to have acknowledged that also. But realistically, we need to get on with hiring these urgent staff. It's gone on a number of years. I can remember watching, video clips on Facebook going back to 2017-18 in relation to this issue and the lack of the new pumps that we're talking about today. So, we're 3-4 years on from those initial protests, and very little has been done. Now, I understand that funding and the posts have been assigned, and if I could just ask one thing of you, it would be to maybe follow up with CUH just to see, what shortly actually means. Are we talking next week, next month, 6 months? Just any type of an indicative timeline would be great for those people. As I said, a number of those children are starting school, and that's stressful enough in itself. Let alone having to be tasked with self-injecting on numerous occasions throughout the day. So thanks for your time, Minister.
Thank you, Deputy Minister.
Garv Mahago Cahirlock, you're multitasking today.
Indeed.
Yeah, Deputy, I do take on board everything you said, and as we said, diabetes is a very, very serious illness, and commencing a child on an insulin pump requires intensive education for the child and the entire family, with close monitoring of glucose levels and insulin doses, particularly in the early stages of insulin pump use. Type 1 diabetes is an intensive condition to manage. However, in order to provide safe care for the entire paediatric diabetes patient cohort, the service has to prioritise the essential components of diabetes care for all children under the care of the service. It is welcome that in relation to the diabetes service in Cork, new insulin pumps will be available at the beginning of July, and plans are well advanced to train staff, patients and their families in the use of these pumps. The hospital has secured additional staffing resources which are in the process of being recruited, but unfortunately, as I know all too well in my role, sometimes recruitment of staff can take up to between 40 and 50 weeks. We will see. We'll check that out for you and see can we get a more indicative timeline in relation to that. And I want to assure you, Deputy, that the South West Hospital Group remains committed to the progressive development of paediatric diabetes services within the group and to improve the service for patients of the South West region. But I know how worrying it is for families and for and especially for young children trying to deal with this now on a daily basis. So we'll revert to you. Thank you very much.